welcome to our talk this evening. Thank you all for being here. We appreciate it so much. I'm Shelly Collins. I'm the current president of the New Zealand Physician Associate Society, and I'm here with my colleagues to tell you about how PAs can bridge the gaps in healthcare in Aotearoa. I will be joined this evening by Ryan Narcisso, who is a PA as well. He's going to give us a kind of a brief overview on what physician associates are, how we're trained, how the profession started. Then I will tell you a little bit more in detail about PAs in New Zealand. And then Hayley Scott is a GP who is Ryan's supervising physician, and she will come up and tell us a little bit about what it's like working with a PA in clinic. Okay, so let's get started. We'll start with Ryan, who's going to come on up and tell us all about PAs.
Thank you, Shelly. Kia ora. Hello, everybody. Thank you so much again for joining our talk today. I am Ryan Narciso, as it says there on the screen. I won't read through that whole thing for you, but basically, after I finished PA school, I took a position at a community healthcare clinic, and then from there went to urgent care, and then found myself in the beautiful and lovely land of Aotearoa, working in rural medicine at a primary care office in Te Aroha with Hayley. So let's get started. So what exactly is a physician associate, a physician assistant? What is this foreign, mythical, magical being? What do they do exactly? So physician associates are medical professionals who practice medicine on a physician-led healthcare team. So that's the key feature of our profession, is a physician-led healthcare team. So we're not trying to take over the role of doctors or other healthcare professionals. We are here to contribute to providing healthcare to those in need. And the other thing to highlight is that PAs treat patients autonomously and collaborate with doctors when necessary. I'll talk a little bit about this on the next few slides, but the important thing to realize when we mention the term supervising physician is that the PA does not need to discuss every single case with their supervising physician, and the supervising physician doesn't need to kind of shadow or tail the PA through all of the consults. It's really more of that relationship between the PA and the physician, and establishing the boundaries and the circumstances with which they operate effectively as a team. So let's talk about the origin story of the PA profession. Like good origin stories, it begins once upon a time, long, long ago, maybe not that long ago, in a faraway land known as the USA. So in the 1940s, the USA was experiencing a very similar problem that the people in Aotearoa are experiencing, a shortage of GPs. So what are we gonna do? People still need health care, and we need to be able to meet those needs. And so what came of that is this first class of PAs in 1965, where one of the doctors, Eugene Stead, noticed that there were several Navy corpsmen who have excellent medical skills, especially in the fast-paced settings as wartime and battles, who can perhaps fill this gap, fill this need. And so he took a group of 4 Navy corpsmen and trained them to offer assistance in the hospital wards. And that was the first class of PAs. And from there, the profession got accepted by the medical community and the federal government, and got the support and recognition of various associations in the US. And then from there, we established a certification process for PAs and made sure that the accreditation process for education met the standards to provide quality care across the country. So what exactly can PAs do? How can they benefit and contribute to your practice? Well, if you take a look at this list, I'm sure you guys can read through it a lot faster than I can say it, you will notice that they do a lot of similar things that doctors do. And it's largely because our training is very similar to that of doctors. Now, again, highlighting one of the differences is that the big piece here is that PAs practice under the scope of their supervising physician. So it's not like I'm going to a GP office and suddenly I'm doing colonoscopies, right? That's not how this works. It's part of a team, and I will work with the scope and responsibilities that correspond to my supervising physician. So hopefully that clears some things up with what our role exactly is in each clinic. So what types of patients do physician associates see? And PAs are trained to be able to see all sorts of patients, okay, regardless of the complexity, the acuity, as long as it is within the scope of their practice. Again, like, PAs are seeing GP-type patients and so on and so forth. And again, it's all under, again, the scope of practice of their supervising physician and making sure that there's this understanding between the two of them of what types of patients and treatments and care plans that they'll be offering to the patients that they consult with. An important thing to know as well, this was very heavily emphasized in my training, is PAs are trained to know their limits and remain within their scope. So the way it was presented to me numerous times throughout my training is know what you know what you don't know, and know where to get help. And I think that is very much ingrained into PA education, and therefore almost like we don't even think about it, we just do this and we live by this to ensure patient safety. So how are PAs trained in the US? So PAs pretty much get a 4-year undergraduate degree, and then they apply, and then hopefully PA hopefuls get accepted into one of these 2 to 3 year master's degree, and it's full year-round study. It's full-time. Like, there's no way you can have a job while you're in PA school. It's very, very intensive. And to meet the requirements to even apply to PA school, you need that bachelor's degree, just like what I mentioned. And you also have a list. Often pre-med, prerequisite courses is part of that, so microbiology, biology, chemistry, physiology, those types of things. And this, I would say, this next bullet is perhaps one of the big differences that maybe you will notice about PAs, perhaps in contrast to like nurse practitioners who are kind of our cousins in the field, is that you have to have a minimum 2,000 hours of direct patient contact experience before you even think of applying to PA school. So what does that look like? In my case, I was a medical assistant for 3 years in a dermatology practice. Some of my classmates were paramedics, respiratory therapists, physical therapists, again, for at least 2 years before they applied to PA school to sort of maybe develop their skills and offer more to aid with the healthcare needs. Now in school, we are trained as generalists, not specialists, in the medical model, another difference between nursing programs. So many PA schools actually take classes alongside med students. I know on my clinical rotations, I was working with interns and residents as well as medical students as well. So it really helps kind of foster that interdisciplinary teamwork mentality. When we do our clinical rotations, it's at least a full year of clinical rotations, and it's over 2,000 hours of clinical rotations in a lot of the general settings, primary care offices, hospital medicine, OBGYN, pediatrics, those types of environments. And I think one of the beautiful things about the PA profession, and one of the reasons why I chose it, is that we are taught to be versatile and to be able to adapt to the needs of whatever clinic or hospital setting we're in, and again, be collaborative, okay, working with our colleagues to the benefit of our patients. So what does the C in PAC stand for? Bam, right there, first word. I'm sure you got it all right. It is certification. So in order to even practice as a PA in the United States, we have to take a board exam, okay? And it's offered through the NCCPA, okay? It's this national organization. And there is a similar organization in the UK, the Faculty of Physician Associates, and it is a rigorous multiple choice exam, okay, and it is quite rigorous. It's 4 hours of very, very challenging questions to make sure that we do have that competency to practice medicine safely. The UK also has the OSCEs, so demonstrating that you can do like physical exams properly. Now, to maintain our certification, it doesn't stop there, y'all. We still have to keep on top of our medical knowledge. We can't just take this exam and practice medicine forever here on out. We have to do 100 hours of continuing medical education credits every 2 years. And you have to recertify on this exam. So in the UK, you have to take this rigorous exam every 6 years. When I graduated PA school, we had to take it every 7 years. They recently extended it to 10 years, and that's simply to match our peers. So our similar clinicians, the advanced practitioners and the doctors. So it's not, that's the only reason why we really did that. And you can see here on this list that there are PAs practicing in other parts of the world, not just in the UK, Canada, US. And there are actually very similar roles in other countries. They're just not called PAs. But our roles are being utilized to meet the healthcare demands all over the world. And this last little section for my portion is just speaking to PAs from the UK. So right now they have 31 programs, and 3 ones are kind of in the pipeline to get started as well. And the thing to note here is their process of getting regulation and recognition in the UK is very, very similar to what we're hoping will match up with New Zealand as well, okay? So next, I'd like to pass the mic back on to Shelly to speak more about the role of PAs here in Aotearoa.
Thank you. Excellent. Thank you, Ryan. Fantastic. I'm Shelly Collins. I'm the current president of the New Zealand Physician Associate Society. I've been a PA for about 19 years now, practiced in lots of different areas, family practice, but also in ORL, did palliative care for a little while. I'm currently practicing at a GP clinic in Papakura East Medical Center. And we moved to New Zealand. I moved with my husband and our daughter about 4 years ago. And we love it, and we plan on staying forever. So this is, I want to read every one of these lines for you right now. No, just kidding. So this is a bit of a busy slide, but the history of PAs in New Zealand initially started in 2010 when we had a pilot program. And then we had a second pilot program in 2013 to 2015 that was actually sponsored by the Ministry of Health and Health Workforce New Zealand. At the end of those 2 studies, they got an independent third party called Synergy to actually look at the studies and see if PAs were a good fit. And they found that, yes, we were a good fit. Everything was very positive. So from that point forward, the PA Society was formed, and we submitted an application to the Ministry of Health to become a regulated, registered profession. And that's what we've been working through for the past, what feels like a gazillion years, but really, it's only been about a decade or so. So our application was underway. We have also been working with Australia to come up with standards for PA training programs. We've already completed that, so we're ready to go as soon as we are regulated and we can start a PA training program in New Zealand, which is what we'd like to do. As of 2024, we are just awaiting approval from the Minister of Health to sign off on this, and then it goes before Cabinet, and then we find a regulatory authority, and then we're regulated. So we're really moving along. We're super excited we're at this point. So you may be asking, okay, if you're not regulated, how are you practicing medicine in the country without regulation? And through an agreement with the Ministry of Health, we are allowed to practice here as long as we maintain our regulation and our certification in our home countries. And only PAs who work or were trained in the US, Canada, and the UK are allowed to practice in New Zealand right now because we have similar training. And that's how that works. We also have to maintain our own malpractice coverage, which we all have, most of us through Medicus, but MPS as well. And we can only work under the same scope as our supervising doctor, which is nothing new. That's what we do anyway. Even in the US, we only work under the scope of our supervising doctor. Kind of the little downside is that because we don't have a medical license, everything we order, every test we order, every imaging we order, every prescription that goes out has to be under our supervising doctor's name for now. Once we are regulated, we expect we will have prescribing rights and be able to do all of this under our own names, just like we do in the US. Okay, this is how we're allowed to get medical malpractice insurance, because as long as we have a certification number, Medicus and NPS have agreed to cover us. We are not covered providers under ACC right now because we have to be regulated first to do that. Where are we? We're just all over the place. We have 43 PAs in 27 different clinics across New Zealand. Doesn't sound like a lot, 43, but when I came over 4 years ago, I was number 6. We could all ride in the same sedan to wherever we were going. But now there's just tons of us all over the place. So what's in it for you in your clinic? If you're saying, this sounds great, but what could a PA really do for me in my clinic? The big thing is that we are another healthcare professional, another medical professional who can see patients for you, which of course decreases wait times, you have better patient outcomes, better flexibility for the doc. My personal supervising doc, we now have 3 PAs in my clinic in Papakura, and my doc is now able to go to just 3 days a week, 3.5 days, instead of having to work 5, because we're there to cover for the clinic needs. We're a fairly young workforce, PAs are, just kind of in general. We're a little bit cheaper than hiring a GP. Okay, so I'm going to let Dr. Scott, sorry I call her Sweetman, to come up and talk a little bit about what it's like working with a PA in her clinic.
So, tēnā koutou katoa, ko Hayley Scott aho, and I'm a GP in both Te Aroha and Ngātia. And we have had the pleasure of having 3 PAs now for, our first one came 2 years ago, and it's been nothing but amazing to have them in the clinic. As you can see, I'm a GP from New Zealand, born and bred in New Zealand, never heard about PAs before, but yeah, it's ended up being a really good thing for us and for our patients. So I get lots of questions about PAs, and the first 2 questions are probably the ones that come up the most. So how long does it take to oversee the physician associate? Well, obviously when they first come into the country and they know nothing about ACC and the New Zealand health system, it does take a little bit of time to let them get their heads around that. But one thing I have found is that clinically they come in and they're pretty much ready to go. Pharmac is always a little bit of an interesting learning curve as well. So it's really those sort of things about New Zealand that take a little bit of time to teach. And then during that time too, you're also developing the relationship, and I think that relationship is really important. So in Ngātia we have Chris, and he's been there for 2 years now, and really the amount of time that I spend overseeing him is minimal. I have to sign all his prescriptions and check all his prescriptions, and of course there's the paperwork bit. But apart from that, we spend half an hour every second week where we sit down and go over some complex cases or interesting things, kind of like a peer group really. And that's really all I need to do. I would say that all 3 of them are more like colleagues for me. I actually even go and ask them questions, just like I would with my other colleagues. You know, this is a tricky patient. What do you think? What would you do? And what would I do? So yeah, we've now. Considering that they are seeing 20 patients a day at least, half an hour every 2 weeks doesn't really seem that difficult to me. And because we actually have 10,000 patients across our 2 practices, and we are now at 2.8 GPs. So if we didn't have these guys, we'd be looking after 3,500 patients each, and that wouldn't be working. So we're really lucky to have them, and our communities are really lucky to have them, because otherwise we probably wouldn't have the service that we do now. So we also employ nurse practitioners, and the main difference I see between the physician associates and the nurse practitioners is really in the way that they think, because physician associates are trained in that medical model that we're trained in. They're kind of always on the same wavelength. And so that sort of discussion that you have with them is, I guess I would say, easy, because that's the way I've been taught. We still love our NPs, so I'm not saying anything bad about NPs, because we also have 2 nurse practitioners, and they're great too. And I think it's one of those and things. You want all of them. You don't just want a PA or just an NP. We want PAs, NPs, GPs, prescribing nurses, and we definitely run as a team, so that, for example, I know what Ryan's really good at, so I will direct some patients to Ryan. I know what my nurse practitioner's really good at, and so I'll direct some patients to her. So the benefits of having a PA for us is that we have a service. We probably wouldn't have a service otherwise. It means that I can work 4 days a week and still have an on-call roster, because otherwise we just wouldn't have it. And probably one of the best benefits is they actually are all really nice people. All 3 of them have made a really nice contribution to the practice, and I would say they're probably our hardest workers. They're always there before me, they leave after me, their work ethic is amazing, and yeah, they've just been a joy to have in the practice. The downsides of hiring a PA, I'm really hoping that regulation is going to take away all the downsides, because the downside is that they can't write scripts, they can't do blood forms, they can't do radiology, and really it's just a bit of a paperwork thing. So once regulation is sorted, I can't actually think of any downsides of hiring PAs. So yeah, my advice, great, go with it, get them, they're great, and yeah, they've just been a bonus to our practice.